Welcome to the Extraordinary Health Podcast. We're here with Dr. Paul Bekkum. My name's Allie. We also have Liz here.
Hi.
And we're going to talk about neuropathy today. So we've got 3 different kinds of neuropathy that we're going to start off with here. We've got sensory neuropathy, your motor neuropathy, and your autonomic neuropathy.
And one other one would be also your central nervous system, affecting your brain and spinal cord. So technically 4 areas. And we'll just kind of briefly hit on some of these here. So,
all right. So jumping off with some sensory neuropathy. So do you want to start us off with that?
Yeah. Sensory neuropathy is probably what most people are going to have, as far as when they're going to come into the office, because a lot of them are going to have that, numbness and tingling, whether that be in their feet or their hands. A lot of times they're going to have a lot of discomfort, sleeping at night because, I've had patients describe their feet as feeling like hamburger, and even just that light touch of the sheets on their feet. Boy, that's hard to say really fast together there. Can, just drive them up a wall, they're not going to be able to sleep. And that even gets into, and we'll touch on this in a little bit here, even some of that central nervous system neuropathy, where that can even be starting to get affected in that they will have really abnormal sleep patterns, maybe not necessarily because of the numbness and tingling there, but because it's also starting to affect their brain and how their brain is working here. So a lot of people then, they don't even realize sometimes just how bad it really is. When they really start to know how bad it is, they're starting to walk with a gait where their feet are getting wider and wider apart because they're just very unstable. There's no way they're going to be able to stand on one foot. That would be some of the testing that we do in the office here with a computer here to just kind of test out your balancing and just see how well you can do that. But, some people just don't even realize how much sensation they have lost until we really get them tested. And, a lot of that is some very simple testing procedures. We're using either, like a pinwheel or a monofilament to just see where they can feel it and where they can't feel it. You can also use hot and cold. We'll use some vibration as well. And there's a lot of people, I can go quite far up their leg and they've lost that vibration, which correlates into, and this might get a little bit deep here, loss of proprioception, or it's the nerve tracts that are running on the posterior aspect of your spinal cord up to your brain. And when you start to lose that proprioceptive sense, or what is called position sense, so basically it's where your brain knows where your body parts are in space, that's where you get very unstable. So these people have issues like even walking, where they're going to lose their balance and all that kind of stuff. They're even going to have a hard time even grasping things because they don't even know how hard to grasp it. They don't even feel what they're picking up. And I know we've had a patient in here recently. They even just got done with some chemotherapy and radiation, and after kind of further questioning her, when we've already run the test and found out that, yes, she's got very severe neuropathy going on here, but it is chemotherapy induced. The only good part about that is, once we get her kind of detoxified, we're going to use some of her lab work there, get her some very targeted nutrition and diet recommendations, literally also using our laser to help regrow some of the nerves and blood vessels so that she can get that sense back. We should see her get better and better and better to the point where, that neuropathy is gone. Chemotherapy, once you get that stuff cleared out of your system, you should be doing pretty good. But we need to make sure that we get her beefed up on, that diet and nutrition side, as well as using some of the therapy in the office here. And there's a lot of patients who have had chemotherapy. It's, unfortunately, there's a lot of people that have had cancers and they've gotten treated, and, there's nothing they can really do about it. They'll give you probably some medications, gabapentin, Lyrica, to help with that. But the problem is it doesn't really last very long. And it's more that we need to help you, detox or get that stuff cleared out of your system. A lot of those chemotherapies actually cause deficiencies in the B vitamins, so a big thing is to get the B vitamins beefed up there. But again, everybody's different. If we literally have their labs, we can really dial it in very specific for them and, help them kind of clear out the chemotherapy that's built up in their system, and, they can start to kind of, function normal again here. So anything that you guys have seen with some of the patients here with like sensory neuropathy?
Yeah. Difficulty walking, difficulty like with just feeling their feet, feeling their hands, pretty much doing anything.
Yeah, we do have a patient that comes to mind that she says she has difficulty even getting ready in the morning for work because she has trouble grasping things, or she'll be putting on her eye makeup and drop her makeup brush and things like that. And
Mm-hmm.
it sounds rough.
Yeah.
I know I've experienced that myself. Yeah.
And it's something that, the biggest thing is that we want to catch things as early as possible, because it's just not going to need as much treatment, and, obviously help give you some things that can be, done at home, as well as, give you some prevention type things to make sure that you're not going right back to, the situation that you're in. So long term, you can keep your body as healthy as possible. We're here to help you hopefully finally feel good and, live your full potential here. But, the testing that we have has been excellent to just help see exactly where you're at, as far as neuropathy goes. And, we're just getting enough information here to even track progress with people here, and we'll keep people updated. We'll even probably get some of the testing posted here. We'll remove people's names so that everybody can remain innocent here. No.
Remain innocent.
But at least we can show people just the progress that people can kind of make with it. And we got some objective tests that'll show them just how they can, or what they can kind of expect and see with improvements here. The big thing with neuropathy, because it is a progressive condition, is at least stopping it so it doesn't get any worse. And hopefully what we want to be able to do is even reverse it for you to the point where you get back to, normal sensation. And the next section here is, motor neuropathy, making sure you have the proper function of everything here too. That kind of ties into chiropractic as well, because we always probably want to be looking at some chiropractic type services there, because there's no way you can get the proper function back until you get the proper structure there either. So where people can have just muscle weakness show up, a lot of times that's going to show up more in the proximal extremity, so like in your shoulders and your hips. People can have weaknesses showing up there. That's can be a sign of some neuropathy. Muscle cramps might be something else, where again you're probably not getting that proper nerve signal. One big thing I can just think of off the top of my head here is people with diabetes. Again, your blood sugars get a bit too high. You can get a lot of muscle cramps going on there. It might seem kind of odd, but the biggest thing to do there is actually to get out and start moving a little bit there. First of all, you might want to massage a little bit to get that cramp worked out, but you got to start using, all of your muscles, all your joints and all that sort of stuff to make sure that, they can stay healthy, because once you start to not use them is where you're going to start to lose them. So, sometimes it could be even just muscle twitches, or little stabs of pain or something like that people might feel. Those might be some signs or symptoms of a motor neuropathy there too. So you guys probably don't get to see it as much, but when I'm testing patients, a lot of times what I'm seeing is, they'll have just some weakness, not like to the point where they can't use it, but it's a muscle grading scale would go up to a 5. 5 is like they're completely normal. A lot of these people are probably in that 4 range, where they maybe have about 80% of that muscle function there. And it's not necessarily just a rehab situation here where we need to strengthen it. It's literally that we got to get those nerves functioning properly again here. And that's where some of the treatments that we use in the office, like therapeutic laser, which we have a brand new one coming in here, Actually just got notified it'll be shipping out, so we should have it here maybe by the end of this week, early next week, which will actually just shorten the times of treatment for people here. So patients that do have neuropathy here, even with our current laser here, it takes about a half an hour to literally do, if you have neuropathy like in your feet, because we're going to literally run that laser from your lower back all the way along the nerves, down the back of your legs and into your feet. And it takes about 15 minutes per leg, whereas with the new laser here, it's going to basically cut that by about 80%. It's going to take like 3 minutes per leg or arm. So 6 minutes to do, both legs, 6 minutes to do both arms, or 12 minutes to get all of them done. So that's going to be, very beneficial for patients. I don't have to spend an hour in the office getting laser treatment done, plus another probably about 15 minutes or so, when we're literally using like PEMF therapy with people here. That takes another 15 minutes or so just so we get their whole body kind of charged up there. But just the speed of treatment for you, I think that's what's going to be nice. So getting into the next one here is autonomic neuropathy, and that's where we even have some of the computerized testing here. It's literally testing how well the sensation is going, from basically throughout your body from your nerves. It's testing actually the sweat glands in your feet and your hands to see if they're functioning properly or not. And if they're not, then we know that your autonomic system is affected there. And with that, what are you guys seeing with some of the testing that we've been done? We've kind of seen the full spectrum of people here, from looking pretty healthy to way in the other end of the spectrum where, it's pretty significant, right?
It's been pretty surprising because we've had older patients that I kind of, I guess, naively assumed would be a little bit more into the moderate or severe end of the spectrum as far as their neuropathy. And then we've had some younger patients in their mid to late 30s that have had more on the upper moderate end, where those older patients are more on the minimal end of things. So that's been pretty surprising, honestly. But as far as the testing goes, for anyone out there that's listening that you're thinking I'm a bad test taker, this test could not be easier. It is a very passive test. You literally just have to rest your hands and feet still for 6.5 minutes. That's the challenge. You just got to sit still. But yeah.
You actually can talk during it too, but
yeah, you're allowed to talk during it, which some of our tests you're actually not allowed to talk. But you are allowed to talk, and you can move your body around if necessary, but you just got to keep your hands and feet flat. That's all that we require of you for the test. So it's pretty easy, pretty quick, painless. So when in doubt, just get it checked out, right?
Oh, I like that.
It definitely, it's not a hard test to do, but it is something that does give us a ton of information, on the patients there, even some stuff where, we could use it for guiding their, diet even a little bit too. So, and a lot of people, it's small little tweaks. I think probably the biggest thing that I've seen even out of it as well is that a lot of people are dehydrated. You talk to people, you tell them to drink, drink as much as possible during the day. Obviously, you get the general guidelines there, but there's a lot of people that they just are not hydrated like they should be. So,
and it's environmental too. You have to keep in mind when you're speaking about hydration, sometimes of the year, some days are drier than others. On those really dry days, I'm sure you notice it, first in your hands or your chapped lips, and that means you're already dehydrated on the inside. So yeah, drink water. Drink water.
Here in North Dakota in the winter time, it's super dry here and it's cold. And because of that, your sweat evaporates really quickly. It's very similar to being down in probably like Arizona, New Mexico in the summertime when it's 90 and 100 degrees out. You sweat, it's dry, it evaporates fast, you don't realize it, And if you've ever visited there and you know people that live there, they're telling you drink, 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 drink. Even if you think you don't need to drink water, keep drinking water because you'll get dehydrated faster than what you think. And I think same thing happens here in the wintertime. I don't know how many people I see that are just dehydrated. Now we have ways of even measuring that with people too. But yeah, getting that in.
Man, we could do an entire podcast on hydration.
Hydration.
Yeah, I feel like you could.
And even, we could get people tested, just find out exactly where you're at and just like, okay, you need to really hit it hard here, and we can get you retested down the way just to make sure that you are, back in the range where you should be at there. But the other big thing that kind of goes along with hydration there is just the minerals, and probably the biggest one is magnesium for just about all these things, and especially when we're talking about, autonomic neuropathy, magnesium is probably the biggest driver for almost all your internal organs. So let me just kind of get into some of the symptoms that people might even see with autonomic neuropathy themselves, which could be changes in your skin or hair or nails. You'll get some different things going on. I mean, hair can obviously get dried out. It could get really greasy. There could be different factors that kind of go into that there. You could get just loss of, again, pain sensations and stuff like that. That's because, like when we talk about your hands and your feet, you start to lose those small nerve fibers. You start to lose the blood vessels or the arterioles, where they maybe start to get a little bit more hardened. You're not going to get the proper blood flow through there, so you're just not getting the proper sensation there. Some of it could even be, hey, you feel like, people might be questioning whether they have a heart attack or not. That kind of gets into some of the other testing that we have, but we do have some testing where we can kind of hook up a three-lead EKG and take you through a full kind of autonomic nervous system check and make sure that everything's looking pretty good. It'll even give us risk factors for atherosclerosis, heart attack, stroke. If that's what we need to do, we can get that done and just make sure that you're not at risk for anything like that. If you are, we'll make sure we get you sent out to get that further evaluated so you can get that treated. So people could be experiencing even the inability to sweat. All of a sudden their nervous system gets affected enough with neuropathy there. You don't get that proper nerve signal going back and forth between those tissues and your brain there, and you're not going to be able to sweat properly. You get into heat stroke or something like that. You probably lost enough water and minerals there that's where you're having some problems there. You're just not getting that proper connection, and you won't tolerate heat very well then. In a cold climate, you can just put on more clothes, right? But you get hot, you can only take so many articles of clothing off. So that's why I'd rather live in a colder climate than a hotter one.
I absolutely hate hot weather. I hate it.
Yeah.
Again, you could even lose control of your blood pressure there, whether it goes high or whether it even kind of goes low. You could get some dizziness, lightheadedness, fainting. Obviously, high blood pressure. So different things. That's where we're going to probably want to order some labs to even back some of this stuff up here as well, so we can look at the biochemical aspect of things, as well as, really some of the therapies that we have are bioenergetics. We're trying to recharge your body back up here, by using, it's called photobiomodulation, or it's laser therapy to help get those tissues healed back up. PEMF therapy, that's actually an electric current. That's helping to charge your body's battery back up there. So that's really what, some of our other testing is narrowing down here too. And we want to make sure that we're addressing the appropriate areas here as well. We don't want to miss and just be treating you for a sensory neuropathy or a motor neuropathy when, hey, we actually need to look at a more systemic thing with your autonomic nervous system. And we can deal with that with some functional medicine treatments. We can even utilize your current labs that you've already probably had done in a medical clinic, but look at them more from a functional medicine standpoint, so we can get your body functioning closer to its full potential rather than trying to keep it from get you back into the hospital or something like that. So then the last part would be like your central nervous system, which is your brain and spinal cord, and kind of talked about that a little bit previously there. People that have really bad kind of neuropathy changes there, and you even think of Patients as they get a little bit older, they get a little bit more moody. They can get some emotional disturbances there, get a little bit snippy. Just your nervous system is stressed. Sleep irregularities there where, hey, they're waking up all the night. They're not getting into that deep, restful sleep. There's different things that people could be using to track that, and we can look at that with them, whether it be an Apple Watch, an Oura Ring, a Whoop strap, Garmin watch. There's quite a few different devices where it can help measure your sleep, and if we can kind of look at that too, that could be something we can factor in and just see, one, how it's doing right now, and maybe give you some suggestions on just better ways to sleep and all that as well. So also, another big things with brain and spinal cord, just like, it's affecting your autonomic nervous system, bladder control. You could be getting chronic infections just because, you're not emptying your bladder, or everything's just you're incontinent, and you actually end up getting some infections because you just don't have the proper control of the muscles that would actually, shut that off. And now it's easier for bacteria and stuff like that to get in there, and you get chronic bladder infections. Some of the other things are just problems eating and swallowing. We're literally starting to affect, your brain stem there. That's where your cranial nerves come from that help with that. And if you're starting to have your brain affected by that, we're going to need to dig a little bit deeper into that for you and make sure that we're getting you the most appropriate treatment, probably getting into some labs again as well as, probably if need be, referring you out to get further evaluated for that. So I think the biggest thing that we just need to let people know is that, hey, if you have peripheral neuropathy, it's serious. It's something you just don't want to mess around with. That's why, we've got this testing equipment. We're offering, free consultations. You can come in. We're going to run that test on you just to see exactly where you're at. You'll be able to see with the testing there, whether it's kind of normal, mild, moderate, severe, or extreme. And, we can let you know what you probably need to be doing here to help get that corrected. If it's something we can get treated in the office, we'll even outline a treatment plan for you, what that's all going to entail, how much it's going to cost. So you're going to know everything ahead of time here. So that way you can make an informed decision if you want to move forward with treatment or not. So anything else you gals can kind of think of here? I left them all
You covered a lot.
Yeah, I think yeah.
We hit a lot of information here, but it's stuff that
It's good information.
people don't think about. There's a lot of areas of your body that you just wouldn't even think that it might be a neuropathy or some kind of nerve problem that's causing the problem here. I hope that was good information for you there. Please, make sure to kind of follow us and even subscribe to the podcast here so you can get further information down the road here. And we'll see you next week.
Thanks for listening.
Bye.
Thanks. Bye.